Hi, my name is Trisha. I've been in the industry now for 9 years and counting. I work for CrystalVision&BetterHearing. Today we're going to talk about the client intake form. Through my experience, I find there's certain things that help me out more in appointments. So for example, my assistant will go through the client intake form with the patient before I see them. Essentially, when I get that paper from my assistant should be able to summarize to me where the client's at. Does she think they have a loss? Are they interested in hearing aids at all? Have they had hearing aids before? Are they interested? Are they concerned about cost? Anything. So when I see the client, I should pretty much know where they're at.
So today we're learning about how to do the patient intake form. You start off with really basic information here, and then it goes into the deeper parts, which we'll go into later. But you first start off with their name, first, last, the date, their family doctor, their birth date, contact information. You want to make sure you check which one they actually use so you know where you're calling. Their email, address. A really important one to get is if they have third-party coverage. Secondary contact. A lot of the times people who come in have a really hard time hearing female voices, so it's something I struggle with often, so they bring somebody with them, and we want to put them down here so that we can have somebody to contact for them. Who they're referred by, because a lot of the time we want to keep track of the doctors that refer us. Or whether it's like newspaper ads, so we know how our marketing is going. So if it's newspaper ad, drive-by, it's really important for us to keep track of. Then we get down to here, which is where we want their family member that they brought with them to be able to sign here so that we can actually talk to them about the patient results. Because a lot of the time, if we can't have that signature, like we can't discuss that with them and they're having a hard time hearing, they need that second person with them to help understand what's going on. So this is the second page. You're going to fill out the client name again, the date again, what concerns bring you in today. So you can always do just check hearing up here and then try and get down after all these questions. What is your goal from today's appointment? Really what you're getting from them, whether they need new hearing aids, they're having problems, where they're struggling. You basically get a general idea after you go through all of this, because then they just start opening up to you and you want to find out exactly what's going on. So you go into their family history. A lot of the times they say no, you just want to know if their parents or their siblings have a history of hearing loss. Has your hearing been tested before? Simple question, when and where that was. Are you currently aware of any hearing loss in your ears, and for how long? Have hearing aids been recommended for you? Do you currently wear hearing aids? Then you want to ask them if you can see them, if they do have them. And you want to check their serial number, the model, and the year if possible. And see how they like them. Are they happy with them? Did they hear well with them? If they're wearing them now and they can't hear you with them on, then that's a problem. So then we want to go in with the difficult environments. So a lot of the times they struggle with TV, group environments. You'll tell right away if it's face-to-face they struggle with when they talk to somebody, because they can't hear you, which happens quite a lot of the time. And then it's, what is your goal for today's appointment? So then you're going to find out, are they looking for new hearing aids? Are they struggling with ringing in their ears? Or do they just need a test, a regular test for work, aviation, RCMP, which is a really quick test in itself. And then the rest, the practitioner goes over with them to get to know them better and to really get down to what they need. biggest goals that I want to figure out from asking all of these questions. I want to find out how we can best help them. So what are their needs? And then from there, you're figuring out how we can get there the best possible way for them. So this third-party coverage may seem like no big deal, but that could make a huge difference in someone's life for being able to get new hearing aids. When it talks about which environments are you having difficulty with, because if they're having difficulties with their family and making those relationships, we want to fix that right away as soon as possible. And you make them see, oh, I am struggling when I talk to them, but oh, they're just kids, you know, they talk low, they don't look at you. Well, a lot of the times it's something we can correct in their hearing and help them with so they can build stronger relationships with their family. Mostly it's just talking to them. If they're sitting here, I will still continue having conversation with them so they don't feel empty here and they're just waiting for some appointment where no one cares about them. We start talking about life, Christmas, whatever holidays coming up, their family, where they're going with their family for the holidays. And tell them a little bit about myself, connect with them, tell them how my family's going, just make them feel like they're friends and that we trust them and they can trust us.
What do you think is the most rewarding part of this career?
Oh, when you get to hear somebody hear again and they are so happy about the quality of life that they're having with their family, that's huge. Because they walk in here, they struggle so much. They are so frustrated, and all of a sudden that pain is gone because they've got hearing aids where they can hear and they can have relationships with people is incredible. It's incredible.
How do you help build the optical side?
Well, a lot of the clients that come in here are elderly, so they usually have vision issues, like myself. And so we can always refer them after the appointment to see I ask them like how old their glasses are, if they're having problems with them, and then we can switch them over to Luke and Jasmine and funnel the flow and because it's also a one-stop here. A lot of clinics don't have what we have, which is hearing and optical in one clinic. And clients really like that. They know they can make one stop, 2 appointments in a day, and it's done. They love that. So it's a real perk and a benefit for being with us. You'll see clients come in with family members for their support, and their family member is struggling with being able to communicate with them. And at the time, they find it's no big deal, like, oh, they can hear me. Then they go in and try demo hearing aids with Trish and realize what a big difference it makes. And then they end up going on trial, which is huge.
Have you had any happy clients coming out of here?
Very happy. Very happy clients.
How do you know?
How do I know? Because they come in and they say, I am hearing things that I have not heard in years. And they're having such a better time with their family members because they're not saying, what, huh, all the time.
Why are clients coming to us?
Because either someone in their life is recommending and struggling with how they're hearing them, or they're struggling with hearing and communicating with people. They're losing touch with other people, which is a huge deal for quality of living. They have needs and they know they can get them fixed here by people who care about them, or they're straight off the street and they're missing out on quality of life and they want to fix that even if they're having troubles accepting it. They want to have it fixed.
Have you heard clients being unhappy at other clinics?
All the time. All the time.
Why are they unhappy?
They're unhappy because they're getting fast and quick service that's not with zero emotional connection. They're seeing multiple practitioners in one place. No one is communicating with them about how long their orders are taking for repairs. Just lack of relationship.
Why do you think you're so good at this job?
Why do I think I'm so good at this job? I think I care a lot about people, and so I'm there to listen, and I have the time. I will make the time to listen to their story, no matter how long it is, and just really reach out to them, build that connection with them so they feel most comfortable being here and coming to us.
What are some things that you do personally that just wow customers?
I don't know. That wow customers, I think a big thing we do as a store is if I haven't done it or the front hasn't done it, we offer them coffee, tea, water if they need it, several times, which sometimes breaks them down and they actually do take it, which is great.